Anyone who's ever done anything worth doing has dreamed big, failed mightily, and mostly started from humble beginnings. This is a podcast about such people. The most fascinating podcast in the world is fascinating because of the stories of the human beings. Hello, everybody. It's Pat DeCerbo, the most fascinating podcast in the world. The reason it's fascinating, in my opinion, is the people that agree to talk to me. It has nothing to do with me. And today we have Daniel Byrne, who's a professor at Johns Hopkins University and from the Albany, New York area originally. And like most people that we end up talking to on the show, Dan is a extremely interesting and fascinating individual. And in particular to me, he's been associated and involved with AI for over 40 years. And we're going to talk about that today as well. Welcome, Dan.
Yeah, nice to meet you.
Thank you. We talked a little bit as a preamble, and as you know, I'm in the habit of asking people about their earliest memories. And I just wondered what your earliest memories might be.
Sure. So I was born in Brooklyn, New York, but we moved out of Brooklyn when I was pretty young. My earliest memories are in grammar school, and we have a mutual acquaintance, John Paracella, and we were best friends in grammar school. We moved to Millbrook, New York, which is a small town halfway between New York City and Albany. And John and I went to St. Joseph's Catholic School, and my earliest memories are just having fun playing baseball and all sorts of sports. And it was a great place to grow up, and I had a big family and just have a lot of happy memories from my childhood there.
Mm-hmm. And Millbrook is sort of mid-Hudson Valley?
Yeah, it's 2 hours north of New York City. It's a beautiful place to grow up, a nice small town. Yeah, it was nice. And it was in the middle of the baby boomers generation. So there were 54 kids in our one class, and we moved through 8 grades together, and we still keep in touch. And it was a great experience. We had nuns back then, and they really taught us the fundamentals, and that paid off to have a good solid education. And then every day before school and at lunchtime and after, we'd play sports, and yeah, it was a great childhood.
So you played sports growing up. What sports did you play? Forgive me. Baseball, did you say?
Yeah, when we were young, we'd play everything, because that's where the fun was. So we played baseball or flag football or the swim team or wherever there was fun. We had a great town pool there, and we were there all summer. And then in high school, I played basketball. I was on the basketball team, and I just focused on that. And I was never a great athlete, but I learned some important lessons from sports that translated into my career. That if you practice, if you stay focused, competition, the teamwork, all of those lessons in sports really helped me later on when I was in my career.
To this day, right?
Yeah. I know you're a long distance runner, so is John, and I did 2 marathons and about 10 half marathons. But that was mostly just to stay in shape.
Mm-hmm. You have anything planned at the moment?
No, I try to run 3 miles most mornings here just to stay in shape, but I don't really do anything competitive anymore.
Mm-hmm. Did you run this morning?
Not this morning because
No.
I have this, but if there's nothing else going on, I'll do that.
So how did you end up in Albany at State University?
So after high school, my first year of college, I went to Brockport, and I also saw John there, or passed across many times, and I did 1 year at Brockport. And then I transferred to SUNY Albany, and I finished up my degree there. I got a bachelor's degree in biology and computer science, and I met my wife Loretta there, and we're still married 40 years later.
Mm.
And I spent 3 years in Albany there, and really enjoyed it.
So, at what point did you get interested in AI?
Yeah, so I really wanted to make sure that whatever job I picked would pay well, be really interesting, and have lots of opportunities. And at the time I was in college, the personal computer had just come out, and I realized that the overlap between the personal computer and medical research would just be an enormously great opportunity to use this powerful technology. So I decided to find a job that was in this overlap of personal computers and medical research. And luckily, right out of college, I found a great job in New York City at New York Medical College, where they needed somebody who would help use computers for AI tools. And I worked for the chairman of surgery at New York Medical College, Lou Del Garcio, and he was a great mentor. And at the time, people probably don't realize this, but at the time, surgeons were afraid to operate on older patients at 65 or older. They really did not want to operate on them because the mortality rate in the operating room was so high. And my mentor, Dr. Del Garcio, decided that that was kind of an outdated notion, and that we could develop this AI tool. We called it the automated physiologic profile that could help take inputs from these high risk older patients and put it all together, and then give us outputs that would help us optimize patients for surgery. So they take older patients into the hospital a few days beforehand, run their numbers through this AI tool, automated physiologic profile, and then optimize them with their fluids and pH, and just get them ready to survive surgery. And it was an enormous success. And now it's routine that older patients have surgery, and people don't worry about that. And that was an early success story with AI. And then for 40 years after that, I've worked in healthcare. Uh, I've always been on the inside of healthcare using AI. And I think that's what makes me valuable. There's a lot of AI, computer science, engineering people who are really smart and have great tools. And then they go into healthcare and they try to use these AI tools in a healthcare setting. And they get frustrated when uh, the doctors say that's not really what they need, it's not helpful, or there's implementation problems. So, what I'm working on now is, how do we take this powerful AI technology and use it in healthcare in a way that improves patient outcomes, helps you and I and our families when we go see a doctor to predict and prevent complications, catch diseases upstream. So this technology is available right now to do good, but it's really not being used in healthcare. There's very little evidence that AI right now is being used to improve patient outcomes. And there's really no reason for that. So that's what I teach about. That's what my book is about. That's what I spend my time working on.
It's fascinating. I feel like we need to get the word out, don't you?
I'm working on it.
What do you? How are you working on it? What avenues?
Well, one I wrote a book on it.
Mm-hmm.
It's not too bad. I'll show you. My book is about artificial intelligence and improving patient outcomes.
Mm-hmm.
And the idea is we need rigorous science to know when we're actually making a difference and when it's just hype. Um, and then I'm also teaching several courses. I teach several courses at Johns Hopkins, and one of them is an online course that is being taken by students from around the world. We've had over 1,000 students in the last 6 months take our AI and healthcare course. So I'm getting the word out about that. And the other exciting thing at Johns Hopkins is Michael Bloomberg gave $1.8 billion, a billion, for a new AI center at Johns Hopkins. So I believe Johns Hopkins has all the pieces to put this together. It's the number one medical school, number one in biostats, number one in nursing, a lot of smart people. And now with this funding for the new Data Science and AI Institute, I think we can accomplish some great things here at Johns Hopkins.
Mm-hmm. So where do you see this going? Like if you had a magic wand, how would you shape it?
Well, with the problem right now is we have lots of people creating AI tools, and they don't get down the last mile of implementation and impacting people. So if I had a magic wand, what I would do is help people, help physicians. First of all, you have to start with problems that physicians need solved and identify the problems that physicians need solved, and then help them build AI tools that will make their life easier. And then the key is when you implement it, you have to compare it to what we currently do, usual care in a hospital or healthcare setting. And then, just like with a new drug, we need to test, does this new AI tool improve the care of patients over the way we were currently doing it? And so my push and what I've been doing for the last 15 years is when we build these AI tools, we test them with pragmatic, randomized controlled trials, just like we would with a new drug. And we see, does this make a difference? Is it safe? First of all, it's safe. And second, is it actually improving patient outcomes in a rigorous way? And I try to raise the bar in a way that our evaluation could be published in the New England Journal of Medicine, because they won't publish things that are iffy or weak evaluations. So my point is, let's do a rigorous evaluation, and one that at the end of it, we can publish that in the New England Journal of Medicine. Now, the pragmatic randomized control trial is different than a randomized control trial. In a randomized control trial, we might recruit people and give some a placebo and some a drug. In a pragmatic randomized control trial, we would just take people as they go through routine care, like in a hospital, and we'd randomize them to usual care or usual care plus AI. So we're not taking anything away from anyone. Everyone continues to get usual care, but for random half, we get the AI tool on top of that. And then we run that for about a year and we see, did we actually help them? Did we reduce blood clots? Did we reduce postpartum hemorrhage? And is their outcome truly better in a rigorous scientific way?
What are you seeing now? Like, is there a coalition of people that are sort of thinking like you are? Or do you feel like you're an outlier at this point?
Well, there's hundreds of billions of dollars being poured into this field of AI in healthcare. It's just astonishing how much money is being poured into it, because people have to see that AI is powerful. And when you ask, where's this going to benefit our society? People say healthcare. Now there's going to be a shakeout. Only about 20% of those people are going to be successful. Only 20% of those startups are going to be successful. And what's going to separate out the people who are successful from those who are not are the ones who are not successful are not going to really be making claims that are based on facts. They're going to use hype and just make up their own facts. And I think society has gotten pretty frustrated with the hype of AI. So I think there'll be a big shakeout. The other thing that I think will be very clear in the next few years is that the hospitals and healthcare systems that use AI in the right way and actually improve patient outcomes will get great publicity, publish papers in the New England Journal of Medicine. They've reduced complications. The patients have better survival. And those hospitals will beat the hospitals that don't do it. And then I think that will force the change.
Can you repeat what you said about the people hyping things? Was that the
Yeah,
winners that are going to hype it or the losers? Forgive me.
I think the losers are going to hype things. So we've seen lots of examples where
Mm-hmm.
big corporations tried to use AI in healthcare and startups tried to use AI in healthcare, and they didn't really have rigorous evaluations, and they would bamboozle people who didn't have the skills to see through it, that their AI tool was actually having these great effects on patients. And that has short term success, but it falls apart eventually. The other thing I like to say is that there's a spectrum with AI. On one end of the spectrum, there are people who say AI is evil, it's biased, we need to regulate it, really stop it. The other end of the spectrum are people who say AI is magical. We don't even need to test it. We just need to use it on everybody. And we get a free pass. We don't need to test it. Those people get short term success, they get some attention. Um, but the real success is going to be in the middle of the spectrum. The people who are evidence based, voice of reason, make statements based on facts. They won't have short term success, but they'll have long term success.
Hmm. I feel like just for me personally, as a neophyte, just an observer, I read the paper and maybe read other things. But the prospect of private equity, large amounts of money, funding things like AI and other things in medicine terrifies me. I feel like in the end, if we're trying to squeeze out every last drop of efficiency from the medical system, that's going to affect patient care in a negative way. Am I wrong?
No, you're right. So that's why I say step one is you have to go to doctors. You have to say, what would be helpful to you? We want to make your life easier. Half of them are burned out or getting burned out. So without doctors and nurses, the system falls apart. So we have to ask them, what would be useful to you? So if you're a radiologist, we don't want to just come up with some AI tool and impose it on you. We want to say, you tell us what would make life easier for you, and we start there, and then we work with them. And the way I've done this in the past is we'd identify these doctors. So I'll give you an example. When I was at Vanderbilt, we had a bunch of doctors who were interested in using AI. So one was interested in how can we predict postpartum hemorrhage. So after women give birth, they can bleed to death or bleed excessively. And you might think this doesn't happen or it, it, it's rare, but it's actually a big problem. So these doctors said, we need an AI tool that could predict postpartum hemorrhage. And we said, all right, we'll work with you. And so uh, we had weekly meetings and we helped her create an AI tool that would accurately predict postpartum hemorrhage. And her and her colleagues really created the tool and we supported them. And so then there's no resistance to the implementation of that. Then they did something really clever. They tested, because sometimes doctors and nurses will say, I don't need an AI tool. I've been doing this a long time. I can tell you which patients will have postpartum hemorrhage. So they tested several hundred of them at different hospitals. And it turns out they couldn't predict it much better than flipping a coin. So it proved we did need the AI tool. Now, like a lot of places, they would just write a paper on that and it would never get implemented or never tested. But we're trying to raise the bar and do something better. So we said, all right, we have a tool. We tested it at several other hospitals, made sure it worked at other hospitals. Then we automated it into the hospital computer. And then for a year and a half, we're randomizing all the pregnant women coming in to usual care or usual care plus this postpartum hemorrhage AI tool. And then at the end, we're going to see we actually help these women reduce their rate of postpartum hemorrhage. And if it's successful, we'll publish a paper in the New England Journal of Medicine. And then this is open source. We don't try to keep these things secret. And then any other hospital can use it, and they can all reduce their rate of complications.
Interesting. If it's open source, that would mean the money to fund the creation of these tools is coming from places like Johns Hopkins with Michael Bloomberg's money.
Yeah, and so unlike large language models like ChatGPT,
Mm-hmm.
these small clinical models don't really require a lot of money. It's fairly easy to create a model to predict something like postpartum hemorrhage. It doesn't take a lot of money. It doesn't take a big computer. You can do it on a laptop. So it doesn't really take a lot of money. And then the beauty of the pragmatic randomized controlled trial is you set it up and it runs on autopilot, and the computer basically flips a coin of heads or tails, put people in one group or the other. And for a year and a half, it pretty much runs on autopilot.
Interesting. So how will the money coming in from, say, private enterprise, the private equity people, how could that be used to help what you're doing, or don't you need them at all? And will they be competing with you somehow, or?
Well, there are a lot of vendors in this space who want to and are creating AI tools for radiologists and hospitals, and there's a need for outside vendors to create tools, but a lot of these can also be created in-house in hospitals by academics and doctors, and be tested that way. So there's plenty of need for money. We have to pay the salaries of the people working on these things. So you can always use money.
No doubt. So where would you like to go with this conversation? Where do you feel like, what would you like people to know, and how can I be helpful in helping you get the word out today?
Well, let me ask you: when you go to the doctor or your family, do you feel like they uh, have improved outcomes based on AI? Do you see AI helping with your own care or what your doctor does?
I don't know. Like I thankfully haven't had a lot of health problems over the years. My doctor, my cholesterol is slightly elevated, and other than that, I don't have any indications, any tests that have indicated that I would need to go on a drug or lose weight or anything. But my slightly elevated cholesterol causes him to say, and he's a good friend of mine, we went to college together, causes him to say that I should go on a statin. So I always wonder, what are the statistics on the statins? And I listened to all these people, like the Peter Attias and Andrew Hubermans and all these doctors online that question the efficacy of certain drugs. And so I don't know, is AI involved in the sort of the maintenance models of, these introducing drugs to people and having them on drugs for the rest of their lives? And I'm a inconvenient patient for him because I don't take direction well, I guess.
Well, you have a pretty healthy lifestyle, and that can be very beneficial. My personal opinion is that statins have been a miracle drug and are definitely something to take. I take them, and one of my boss's boss was a physician, and he had a conversation with me about his own health, and he said not only did he want to take the statin to get his cholesterol in the normal range, but he wanted it to be in the lower part of the normal range because he saw evidence that that really helped. Where AI can help here is that high cholesterol could lead to a heart attack eventually. And right now, our healthcare system is very reactive. We wait until people have a heart attack, and we have fairly primitive scoring systems to say who's at high risk. And what the AI tool can do already is compute the probability that you're likely to have some event in the future, like a heart attack, and then help you prevent that from happening. So there's so many things in our healthcare system where the healthcare system is reactive. And what the AI tools can do is be much more proactive and prevent complications in hospital and catch diseases upstream when they're treatable. So, for example, right now, you and I might have multiple myeloma, a cancer in our bloodstream, and we don't know it. And in our healthcare system, the way it is now, without AI, we won't know that for another 3 years. And then a doctor's going to tell us it's too late. You have 3 months to live. We can't do anything about it. But I built an AI tool, and it could easily be used when you're at your doctor's office, just taking the routine blood test and compute probability that you'll develop multiple myeloma. And when you catch it early, it's easy to treat and you'll live a normal life. And I think most people don't realize that that's the way it is for hundreds of conditions in our healthcare system, that we're reactive and we wait too long. And these AI tools can completely change that and make them proactive.
It's so interesting.
It's hard to change the healthcare system. So related to what we were just talking about, the fourth leading cause of death in this country is preventable medical errors. So that's another area where AI really can make a difference. There's no reason that the fourth leading cause of death in this country, with the amount of money we spend on healthcare, should be preventable medical errors. And AI won't fix all of that, but AI can help with a lot of that.
And how could AI help with that?
Well, so here's an example. You go into the hospital, you're fairly healthy, you have some minor procedure, and you develop a blood clot and you die from a blood clot. We've developed AI tools that can accurately predict when patients are admitted to the hospital, which ones are likely to develop a blood clot in the hospital. And then the physician can give them a drug to prevent the blood clot. But that's not being used routinely now. And that's just one example, but you can multiply that times 100, and those are your preventable medical errors.
So you would develop a checklist of the probability of possible preventable things, like a checklist almost, and test for that pre-surgery or
So I'll stick with the blood clot one. When I was at Vanderbilt, I just left there 2 years ago and moved to Hopkins. We developed a way to predict blood clots in the children's hospital. And children don't develop a lot of blood clots, but when they do, their mortality rate increases sixfold. So it's really important that we can predict them. And you don't want to treat all of the children with this medicine to prevent blood clots because it has side effects. So you want to know who has a high probability of blood clot. And then we had a physician who was very interested in tackling this problem. So she's the lead on this. And then we met with her once a week, and we took a big data set, 100,000 patients from the last 10 years, and we said, which patients developed a blood clot and which ones didn't? And then we looked at different factors that might predict it, their age and gender and their lab data, if they had a previous history of blood clots. And then we tested those. And then we boiled it down to about 15 that were important. And then we put them in an AI tool. And we tested this tool to see if it would predict blood clots. And it predicted very accurately. And then we automate that in the hospital computer so that we know every day all the patients are ranked by their probability of a blood clot. And then she would round on the high risk ones and talk to the doctors and say, this child is at a high risk of a blood clot. Are you okay with us giving us this medicine to prevent the blood clot? And then we tested that in a randomized controlled trial. And we made sure that this approach is safe and that it would help patients.
Interesting. And how many potential things can you imagine you're testing for pre-surgery? Or like I mentioned a checklist and you said I'll stick with the blood clot, but would there be like 25 things or 50 things? It seems like could be trying to predict the future is difficult.
Yeah, I think you have to do it one complication or disease at a time. I wouldn't try to create one AI tool that did them all. So we've built these AI tools to predict blood clots, postpartum hemorrhage, 30-day hospital readmissions, pressure injuries or bed sores. And there's lots of opportunities here. I talk to people every day who want to develop an AI tool to predict something. When a woman gets a mammogram, the radiologist is really smart and works at looking at that and identifying if this is cancer or not. And the AI tools can provide a second opinion or see if they missed anything. And the other opportunity for AI tools with mammograms is they can probably predict the breast cancer earlier than the radiologist. So again, you catch these things when they're upstream, and then they're much more treatable.
I've heard this about all kinds of like X-rays and other scans that AI may be better than a doctor at identifying the problem.
Yeah, the challenge is the last mile work and the implementation. So, Jeff Hinton, the godfather of AI in 2016, said we need to stop training radiologists, that AI will do better. He was wrong about that. We have many more radiologists now, and AI isn't going to replace the radiologist. So that's an example of a person who's really smart at AI going into the healthcare system and not understanding the implementation. So we need radiologists to tell us how could we develop a tool that would be useful to you and not make more work for you, make less work, and make it in a way that patients benefit. And there's a lot of people working on that now, and I think it's an exciting time because there's great potential here. I think in the next 5 years, you're going to see AI completely transform healthcare.
Will it save healthcare money?
I think it will. A lot of our costs are due to complications, catching things downstream, right? So if you and I are diagnosed with multiple myeloma 3 years earlier, the cost is much lower than if we wait 3 years and they're trying to treat it while we're dying. So preventing postpartum hemorrhage is a lot cheaper than addressing it in a reactive way. So I think all of these tools, catching things upstream, can be used to save money.
Interesting.
30% of our healthcare system is waste right now. So, we can cut out the waste. The other part is in a hospital, for every doctor, there are 9 administrators. And a lot of those jobs can be helped or replaced with AI. And I don't believe AI is going to replace most jobs in healthcare. It's not going to replace doctors or nurses, but there are administrative jobs that add to the cost, and AI can help there. The exception to what I just said is in a lot of other countries, there's a real shortage of specialists. So in India, I believe there's one pathologist for every 9 million people. So uh, they're going to need AI to function as a specialist in a lot of other countries.
That statistic about administrators sounds crazy to me. How could there be 9 administrators for every doctor in a hospital?
Yeah, yeah. It's well, that's why there's 30% waste, right? It's our healthcare system is broken, but it's not the people. There are great people that work in our healthcare
Agreed.
system.
No
Great
doubt.
doctors, great nurses. A lot of hospital administrators are great. The problem is with the system. The system is broken, and there's too much bureaucracy, and it's too resistant to change. But the way it's going to change is there are going to be hospitals and healthcare systems that realize that AI has potential. They're going to use it the right way. They're going to base things on facts, and they're going to beat the competition. And patients are going to flock to these hospitals that lower the complication rate, reduce readmissions, improve patient outcomes. And the other hospitals are going to have to follow along.
Just good old fashioned competition in
Yeah.
America.
There's not a lot of competition in healthcare, but there is competition, and patients want to go to the hospital that's going to give them the best outcome. And a lot of these outcomes are now publicly reported, Hospital Compare and other websites. So I believe that's going to be the driving force, that you can only hype things up and make up your own facts for so long, and then the consumer is going to see through that.
It's interesting. I feel like there's so much confusion everywhere. Like when you're talking about what's fact and what's not.
Mm-hmm.
You know, the media being the best example. You know, I don't know. I feel like everyone's lying to me.
Yeah. Well, luckily, I was trained as a biostatistician, and I spent 40 years analyzing medical research data and publishing papers and evaluating what's a fact and what's not, and really doing it in the most rigorous way. So that part of my background is really useful in AI, because there's a lot of people in AI now that don't have that foundation of evaluating things in healthcare, and they're kind of reinventing the wheel, and not really in a great way.
Interesting. So do you spend time refuting what those people are?
I decided that it would be better for me to uh, be a positive role model and to create demonstration projects of the right way to do it, rather than criticize other people. I don't like to criticize how people are doing it wrong. I like to create demonstration projects of, this is the right way to build an AI tool, right way to validate it, right way to do a pragmatic randomized trial, and the right way to write a paper about it. And then let people see that that's an example of the right way to do it.
It sounds like you're a great combination of form and substance. I mean, that's a really sensitive way to look at it. And I think it's easier for people to hear something that's positive. Like there's so much negativity out there just tearing down what someone else says, but
Yeah.
just focusing on what you believe the truth is.
Well, and I think a lot of journalists lack the skills to report the truth about AI. So they'll often just repeat what's ever in a press release about some new AI tool. And I think you do a great service by digging a little deeper into what the facts are. But when a journalist has no training in AI or biostatistics or medicine, and they report on something, they don't really have the skills to question things, and they don't have the time. So, there's a shortage of investigative journalists, and that's an issue. So I'll just give you a quick example. So in a lot of AI tools, they'll report the overall accuracy of the AI tool, and people think, "Oh, this tool here is 99.4% accurate at predicting hemochromatosis," and they'll think, "Well, that's really a great AI tool. It's really working." But the AI tool could just say that nobody has hemochromatosis. It's completely worthless. It just says no all the time. But hemochromatosis is rare. It only happens in 4%, 0.4% of the population. So the model is still 99.6% accurate, but it's completely worthless. But journalists don't see through that claim of accuracy, and hardly anyone else will even question the overall accuracy. So a lot of what I teach in my course is how to see through being bamboozled, how to do it the right way, how to raise the bar, how to be in the 20% that are successful. And that message seems very popular. A lot of people want to get into healthcare AI, and they need these skills. There are also a lot of people in healthcare who are making big salaries, have important jobs, and they were never trained in AI. So they need to get get an upgrade in their skills, but they don't want to go back to school and get a PhD. So the courses have been popular with that group also.
That's terrific. What other observations do you have going forward that might be useful for people to know?
I think we've turned the corner where people realize that AI is powerful, and that a lot of the claims in the past were uh, false claims, and I think people are beginning to see that we need to treat AI like any new drug that a drug company comes out with, and a drug company can't just come out with a drug and say, let's bypass all of the testing, and we'll just tell you that it's effective, and we don't even need to test that it's safe. Nobody would give their child a drug if it hadn't been tested for safety, and they wouldn't pay for it if it wasn't effective. So we need to start treating AI like a new drug and test that it's safe, test that it's effective, and really raise the bar there.
Mm-hmm. Is there anything else that you might like to talk about today? Any questions for me or any comments?
I think you do a great job with this podcast. I did have a question for you. I think we have a common area of interest. So I've written 2 books, and I decided my next book, I really want to focus on a different topic, and that's how people accomplish the American dream. And it's fascinating to me. It's sort of a hobby of mine of why some people accomplish the American dream and some don't. And only about a third of the people in this country even believe in the American dream. But that's also the percent of people who accomplish the American dream. And I know a lot of your podcasts, your interviews are about people who accomplish the American dream. So I thought this would be a good opportunity for me to pick your brain and ask, why do you think only a third of the people in this country accomplish the American dream? And what do you think they need to do differently if they're not?
What does American dream mean?
That's a good question. John asked me the same question. And I think each person gets to define it themselves. Each person has their own definition of the American dream. So, but even if you let people define it themselves. 2/3 will say they didn't accomplish the American dream and they don't even believe in it. So I think that's sad. And um, I think there's ways that we could help people accomplish the American dream with better education.
It's interesting. I mean, there's so much we could speculate about, but I would say, for me, I believe more or less that it's a personal experience that determines whether or not I think I achieved the American dream. And that could be, I have friends that are in relatively low paying jobs and are able to afford their rent in a modest apartment. And they try to eat right and they're physically fit and they're clean and they don't use drugs and alcohol and they're happy. So those people, mostly I know them through sports, like running and stuff like that. I think that they think they are living the American dream. They don't have a lot of money, which a lot of people think they want to have a lot of money and that will make them happier. I know I work real hard to try to pursue getting more money, and I'm not convinced that it makes me any happier, meaning when I get the money. I'm happiest when I'm pursuing a hard thing. So whether it's a triathlon or a business endeavor, like for me, that makes me happy. And I happen to believe that for me, that happiness is the progressive realization and or pursuit of a worthwhile goal. So if a person defines what the worthwhile goal is, whether it's paying their own rent in a modest apartment and being physically fit and eating right and having loving relationships, or whether it's building a company or being president or CEO of something, to me, it's very personal. Like, who's to say that my life is less than your life if I'm just, for example, like a custodian at the high school I went to, and I live modestly and have friends and family and try to eat right. And that, to me, I don't know. For me, I think that would be living the American dream. I also happen to have lived in Barbados and Mexico and Spain over the years through 3 terms abroad when I was in college. And there's lots of happy people that don't have a lot of money. Like the problem I have with people defining the American dream is there's some ideal they think they need to be happy and to have lived the American dream. And, I read a lot. I've read a lot of history and philosophy and religion, and I've pretty much decided that the Buddhists have it right and that we can be happy in any circumstances if we're happy inside our own heads. So with that in mind, I could be living the American dream no matter who I am. And therefore, the third of the people that don't think the American dream is possible, whatever that even is, I don't even know what that is. Used to be people would say the American dream is to own your own house. I'm not sure, that's for me. Like, I don't know, would I be worthless if I didn't own my house and I lived in an apartment? My personal feeling is we don't ever own anything anyway. It's really, we're just kind of using it. We're passing through. And then the piece of paper that we have that says we own a house is really experiences a lot of friction anyway. But like in order to own the house, you have to pay rent to the government, basically. You pay property tax and you pay for your water and sewer and all that stuff. So I feel like they own the house and we rent it from them, kind of. I mean, we might have a loan at the bank too, but once we pay that off, then I think the government owns it and we're renting it from the government. But the determination as to whether one is living the American dream, really, to me, is the question. What do I define it as, and is that achievable by me? Like what I'm hearing you saying in general, the third of the people that think it's not achievable, I believe someone is telling them it's not achievable, and the reason it's not achievable is because of some big enemy force that's preventing them from getting what they want.
Mm-hmm.
I don't
Yeah,
know.
no, I agree with everything you said there. But it's actually um, a third of the people believe in the American dream, and two-thirds don't even believe in the American dream, and two-thirds say they have not accomplished the American dream and probably will never.
Mm-hmm.
So that's a huge proportion of people in our country. But I agree with you that you have to define it yourself, and a lot of it is your mindset. But there's a lot of fascinating things about um, people who I know you've interviewed who have accomplished the American dream and what they did differently from the two-thirds that say they can accomplish it and haven't accomplished it.
To me, it's really boils down to where's your locus of control. If you feel like there's something outside of you that controls your happiness, some amount of money or some amount of anything, then you can never be happy. And again, this is not new. It's thousands of years old. If I can control this, then I can be happy. And I
Yeah,
struggle with it too, like everyone else. I mean, I've been successful, I think, by any measure, financially and otherwise. But every day I wake up and I want to climb a mountain. And some days I have crises of faith. What am I doing?
mm-hmm.
Does this make sense? Why do I work this hard? Am I going to feel better once I achieve X, Y, or Z? And what goals are being thwarted by government or other human beings? And then my mind starts to work on me and affects my ability to be happy, really. And I
Yeah,
think that happens at all levels of every socioeconomic level. And you could be a Mother Teresa and have nothing. And she lived in Calcutta, but if she were in New York, she might say, I'm happy and I will
mm-hmm.
always be happy. So
Yeah,
she achieved the American dream, or the Calcutta dream in her case. Um, I think there's people like her everywhere. And then you've mentioned several times, there's a spectrum of AI, there's a spectrum of medicine, there's a spectrum in everything. But mostly, I think people's ability to feel as though they've been successful pursuant to some standard has more to do with their orientation and what they decide to believe. And unfortunately, I believe the media tells people what to believe. It's just over and over and over. You can't make it, and this is why, because the other team is bad,
yeah.
no matter
I
who the
think
other team is.
I think you're right. The media brainwashes people into being pessimist, and obviously you've accomplished the American dream, and I think you do a great service by teaching other people how to accomplish it with these interviews and going a little more in depth than a typical journalist.
Well, thank you. That's a nice compliment. And, I'm not really sure how effective I am. I'm grateful for the kind words. But for me, like, I just try to stay focused and try to be happy in the moment. Like, what makes me unhappy is obsessing about the future, or worrying about what flaws or sins I committed in the past.
Mm-hmm.
So I was less than I wanted to be in the past, and I can obsess about that for the rest of my life, and I can't change any of it.
Mm.
I'm pretty open about the fact I don't drink, and I heard someone in an AA meeting one time say, in the past, I did what I did, and I didn't do what I didn't do, and that's it. I cannot assign any value to any of it because it's not useful to me. And I really related to that. It's
Mm.
not that I don't wish I did better in the past, but I can't change it. And
Mm.
then worrying about the future is whether I'm not going to get what I think I want, or whether someone's going to take something that I believe is mine. both of those, those things are by definition steal my happiness.
Mm-hmm.
So I try to decide what's important to me in the moment, like today or in this hour or in this minute. And I've decided if I'm with another person, that is to be absolutely present. And my mind wanders, to be honest. I'm here with you for an hour, and I have to focus, because left to my own devices, my brain goes to all these other places, wants to worry about all these extraneous things that are not productive at all. Instead, I want to be present with you and focused on you and trying to get you to tell me and anyone who might be listening your view of the world. Because to me, that's why we're here. We're not here to listen to me talk, even though I'm talking right now.
No, it's fascinating. And part of the reason that I decided to write this book about the American dream is that whenever I have conversations with people, when I mention this, just what happened here, people tell me fascinating stories. Instead of talking about the weather, they open up and tell me fascinating stories. So it just improves the level of conversation to say you're writing a book about the American dream. It's unbelievable the interesting stories that people have told me.
Well, everyone sees the world and experiences everything through their own prism. So when you say something like the American dream, automatically, whatever it is for a person pops into their head. And most people are given the opportunity, happy to tell you what it means to them, right? But for me, who's to say that I'm not living the American dream if I live simply and happily in a tiny apartment or tiny log cabin and take walks every day, whether I'm in New York City or in Saratoga Springs, or where you live, which is beautiful, Maryland.
Everybody gets to define their own version of the American dream. Yeah, I agree.
And the other thing is like the comparing mind. Like I had a house in Lake George, and I was like, had to have this house in Lake George growing up since I saw this house that someone else had in Lake George when I was in college and in high school. I always had to have it. And then I got it. And of course, I wasn't any happier, and we didn't use it very much. And so that made me actually less happy. And we got rid of it. And I tell people, like, people are like, where are you traveling and this and that? Oh, I love to go here and there. And believe me, I've traveled, all over the place, all over the world, all over the country. And I continue to. But I'm never any happier anywhere else. It all has to do with like what's in here. Like, so I find that I like to just be happy at home. And
me too.
And I feel like and of course it's temporary, my brain always talks to me. My life will be perfect if this. Have you ever heard of the necessary lie?
No.
I heard it from this guy, Dan Sullivan, up in Canada. He's like a business consultant, but he said like one way the necessary lie manifests itself as you get out of college and you say, if I could just make, 25,000, then my life would be perfect. And of course you make 25, and then he says, if I could just make 50, then I'd be happy. And then of course you get to 50 and you're like, well, if I could just make 75. And eventually you realize that true happiness doesn't lie at any level of attainment, whether it's money or stuff or love or like any of it. Once you get it, you realize like you move the goalpost. It's he has another thing he calls the gap, which may be part of the necessary lie. And the gap is what's between where you are and where you think you want to be. And you're waiting until you get to that place you think you want to be until you're happy. Like once I get that new swimming pool in my yard, then I'll be happy. And then, I don't really, actually I have a house and I have a pool and I have the car I want, but I think I want a different house with a different pool and a different car. And it just never ends. And so his point is, you can choose to be happy now, no matter what your circumstances are. And just saying this to you now is a great reminder for me, because I'm like, like I said, I'm always on this treadmill and thinking I want to do more and be better. And all that's true. I do want to do that, but it's it's a fool's errand for me if I think I'm somehow going to be happier with the next amount of money or income or prestige or some item that I may want to buy. None of that stuff ever made me happy. I'm only happy in the moment, sort of achieving what I view to be the accomplishment of a worthwhile goal. And even that needs to be reassessed all the time. And
Yeah.
I'm pretty confident that what you and I did today is probably the most important thing I will do today. And that is we made a contribution into one another's lives. And I don't know. Am I wrong? I feel like that's the most important thing.
See, I think you are the fascinating part of your podcast. You say that you're not.
Oh my gosh.
And I think you gave me a chapter in my book.
Oh my gosh. That's so great to hear. I was reading this thing on gratitude yesterday. It was actually Andrew Huberman, the doctor. Have you ever heard of him?
No.
He's quite famous. He's at Stanford, and I think it's Hueberman. But he's talking about gratitude and the way he thinks about it. And he's a neurobiologist, I think, or neuroscientist of some sort. And he says, we're told that we should have a gratitude journal and we should write this stuff down. And he said, I don't know if it's neurobiologically, he said, that's not how you actually get the payoff. The way you get the payoff on gratitude is for making contributions into other people's lives. And when they express gratitude to you, that's when you get the serotonin or dopamine hit.
Oh.
And I was like, oh my gosh, what a great analogy or a great statement. And talk about wanting to do better and be better and to help other people. Something happened to me this weekend that was crazy. And I don't even know where it came from. You have this well inside you from which you create, like you're writing more books and you're fabulously and, very intelligent and very productive and very creative. When you just sit by yourself and all of a sudden this comes from the divine or wherever it's coming from, and you're like a medium almost for what you put on the paper. Well, a friend of mine called me and he said, a couple people in my company got fired. I'm in distress. I'm taking a demotion. It may not affect me financially, but I feel I'm hurt. I've been here for a long time. I've given my life to my company. I'm cross-trained in everything and this and that. And he went on and on and on and on. And I said, this sounds like the biggest opportunity of your career. And he's like, what do you mean? I said, you're cross-trained in everything. They just fired the two people who manage you. And obviously your CEO isn't doing this for fun. He's feeling some distress or he's worried about the future or this and that. I said, if I were you, I would go to them and say, I'm going to be the best person you could possibly imagine at trying to help you succeed at your initiatives. Please tell me how I can help you. And he was like, transformed. He's like, this is great. He's like, you sound like a motivational speaker. He's like, but it's all good stuff. And I was like, well, what better way to make yourself feel better and him feel better? And so what happened, of course, is I got all this gratitude from him. And then I was like walking on air for the next couple hours. And, so I make another contribution and then get that positive feedback. And it was a real eye-opener. And at some level, we probably all know this. In order to be happy, we have to make contributions into other people's lives. Because when I'm just inner-directed, as I like to say, I cannot be other-directed. And when I'm inner-directed, I'm very selfish. I want this, I want that. And I want everybody to serve me. And I sound like a 5-year-old child. And it happens. I try to minimize it, but it definitely happens. What about me? And when I'm doing what about me, like, I'm absolutely useless to other people and myself. How about you?
These are all lessons that we've learned over our lifetimes. And I guess I think it'd be useful to teach younger people a lot of these lessons so they don't have to learn by trial and error. And I hope that's one thing that I can put in this American Dream book, that most people live their lives by trial and error. And if we can teach people when they're younger a lot of these lessons, it could be enormously beneficial.
I agree. I feel like, with the breakdown of, I'm not terribly religious, but with the breakdown of religion, there's no place to get like these timeless truths. There's no place we congregate and hear a sermon. If we don't go to church, I'm just saying statistically, there's a breakdown of community. But, you had, I don't know, 2,000 years ago or more. How old is Socrates? I don't know. But he was in the street talking about these, axioms and postulates. And, or maybe that's just math. I don't know. But things that are fundamental truths, or that he viewed as fundamental truths. And the Buddhists did it. And, religion, philosophy, history, we can get it in various ways. Religion. Religion, I think, being where I got most of mine, sort of in the Catholic Church. That's where I learned most of these things. And I believe them to be true. Like, if I can let go of everything, then I can be happy. Then I can just act in my interest and the interest of others in the moment. So you're in a position to do a great service, I feel like. And I'm a voracious reader, and I would be delighted to read this book. And I think you can help a lot of people.
Yeah, I agree with you. It's rewarding to help other people, and that's why I do the work I do in AI in healthcare, because it's very rewarding to see that your work saves lives and benefits people. We're all going to be patients at some point, and we want the system to improve. And there's never been a time where there's been such great potential and such great need. And anyway, I'm excited about Johns Hopkins and this Bloomberg investment, that we can put all the pieces together and do something really big here. Oh, and I'll plug this. Johns Hopkins, with this new Data Science and AI Institute, is hiring lots of faculty in AI. So anybody that wants to get into that field, apply to Johns Hopkins TSAI.
That's great. That's a great advertisement. Hopefully we'll have some listeners that'll spread the word.
Yeah.
Is there anything else that you might like to comment on or say before we wrap up?
No, I appreciate your comments on the American Dream, and it's interesting to hear all the ideas you had there. And I think it's really exciting. We're gonna see amazing things happen with AI in healthcare in the next couple of years. And the key thing is, we just need to do rigorous science and treat AI like a drug and really rigorously evaluate it. What I say, it's like people are driving in the dark with their headlights off, and I'm just saying, turn on your headlights so you can tell if you're going to where you want to go. And the way you turn on the headlight is with a pragmatic randomized control trial. And I say that so often that my colleagues have started to call it the Byrne test. And for 75 years, there was the Turing test, where we wouldn't be able to tell if it's a computer or a human, say on the other side of ChatGPT. But we've passed the Turing test, and it's not useful in healthcare. The Byrne test is, if we randomize people in a hospital or healthcare system to usual care or usual care plus AI, does the AI actually improve their health? And if you do this the right way and you get the last mile of implementation done, you'll have something that could be published in the New England Journal of Medicine. And so I'm trying to raise the bar so that we can really help people and move away from the hype and bamboozling.
A lofty goal and worthwhile, in my view. Well,
Keeps me
thank
out of
you.
trouble.
No doubt. It sounds like 2 full-time jobs, at least, meaning writing the book and doing your regular work, which I sense takes you 14 or 16 hours a day.
I enjoyed talking to you.
Likewise. Thank you for your time, and happy holidays.
All right. Thanks. Take care.
Bye, Dan.
Bye.
If you enjoy the most fascinating podcast in the world, please follow on Spotify, subscribe on YouTube, and follow on Apple Podcast.